Being in a mental health crisis is not a crime, and we're here to connect them to resources.
Approaching crisis with compassion. That's what the Richmond RCMP Vulnerable Persons Unit is committed to with their Fox 80 program. Along with psychiatric professionals from Vancouver Coastal Health, the team delivers appropriate response to those in crisis.
Having a psychiatric nurse in the car is volumes for us in terms of them understanding the client's needs better. It's a more trauma-informed practice. You know, when you have the nurse there who can provide the information, talk to the person, conduct a fulsome assessment within the safety of the police.
Right now I'm sitting inside the Fox 80 mental health crisis car, where a psych nurse would ride along with an RCMP officer to respond to mental health calls in the community. They patrol the streets 7 days a week from 10 a.m. to 9:30 p.m. and regularly conduct wellness checks for those particularly in need.
It also offers, awareness and education to our frontline officers. And of course to our police officers in the car, because they're spending their whole shift in the car with the nurse. And we learn so much about mental health challenges or mental illnesses, and of course all the support services.
If someone's in a mental health crisis and they're not able to process information like commands, like get on the ground or do something different, that can trigger an escalation in the police response. And so being mindful of those situations and being able to respond effectively can prevent injury and tragic fatalities.
The Canadian Mental Health Association says programs like Fox 80 are crucial for the education and destigmatizing of mental health needs. The organization also leading its own community-led crisis responses known as PACT, or Peer-Assisted Care Teams, as an alternative to policing. Currently operating out of Victoria, New Westminster, and the North Shore, the team has received more than 2,500 calls this year and hopes to expand throughout the province.
And then that's freeing up those resources for co-response so that we can reduce the need for police ever to go alone to a mental health crisis.
In Richmond, Cecilia Hua, City News.